Now let's come towards the stages of the general anesthetics, the way they work. We have generally 1, 2, 3, 4 stages. The very first stage is induction, and this stage, the very first thing observed will be pain sensations will be lost. Okay, and some books state that in this particular stage, the very first one, induction, sometimes amnesia might also be seen, means memory loss might also be observed. And some other books state that in the same stage, induction, there will be a kind of altered way of consciousness. A person will remain conscious, but there will be a kind of alteration in the consciousness condition, due to which the person might also have amnesia, means memory loss. And the second stage is excitation or disinhibition. This is the very second stage in which what happens, we are supposed to do the inhibition, but it is actually undergoing the disinhibition or excitation for a very short period of time. It is believed that, okay, for a short period of time, what will happen? The heart rate, blood pressure, breathing rate, etc., these will become irregular. Irregularity will be observed in the rates, okay, and in the same stage there will be amnesia also. And next one is the surgical anesthesia. This is the very step in which the surgery is performed. So here what will happen? The entire body will become regular. All the mechanisms will become regular. So, and the next one, the last one, that is the medullary depression, a very critical stage. Here, if the medulla becomes depressed, then you know your breathing center is medulla, it will become depressed. After depression, a patient may move towards a state that is death. So what we do in this stage, if anesthesia is proceeding towards the medullary depression, the fourth stage, then we actually apply some mechanical and pharmacological support to bring back the person towards the surgical anesthesia stage. So like this, our